It is indeed an honor and privilege to be here this evening as we discuss our shared goals towards improving the nutrition of children and women in South Asia, a matter of great significance. As the Prime Minister of Sri Lanka, I extend my deep appreciation to the SAARC and UNICEF Regional Office for South Asia, the organizers and stakeholders who have made this event a reality by bringing together an eminent group of leaders, policymakers, researchers, and advocates from across South Asia. I'm pleased to observe that the theme for this conference focuses on reducing anemia in adolescent girls and women of South Asia. Every national government of South Asia has committed to achieving the indicator 2.2.3 of the 2030 Agenda for Sustainable Development, which focuses on reducing anemia in adolescent girls and women aged between 15 and 49 years by 50%. Today, we have gathered here not only as representatives of our countries, but also as guardians of the future of our region, one that rests heavily on the health and well-being of our adolescent girls and women. Today's event is not merely about health statistics, but also about dignity, equity, empowerment, opportunity, and inclusivity for every girl and woman. South Asia has become the most populous region in the world, hosting almost 1/4 of the global population. In spite of this, the region has relatively weak healthcare infrastructure and facilities compared to other regions in the world. Despite diverse cultures, languages, and economies, South Asia shares common social determinants that intensify anemia. Dietary deficiencies, inadequate sanitation, limited access to health services, child marriage and pregnancy, and entrenched gender disparities. Regardless of collective efforts, all forms of anemia remain a critical public health challenge in South Asia. Anemia remains one of the most crucial yet preventable public health challenges in South Asia, mainly affecting young children, pregnant and postpartum women, and menstruating adolescent girls and women. It affects over half of our women and adolescent girls, impeding cognitive development, increasing maternal and infant mortality, and weakening our collective potential. Moreover, anemia is a multifaceted challenge, deeply intertwined with nutrition, poverty, education, gender inequality, and access to quality health care. Adolescence is a critical period of growth and development, and anemia during these years compromises not only the physical and cognitive potential of young girls, but also their future roles as active members of society, including potentially being healthy mothers. According to the World Health Organization, globally, 30.7% of non-pregnant women aged between 15 and 49 years suffered from anemia in 2023, while the percentage of this category within the South Asian region was between 33% and 54%. 54%, that's half of our population, more than half of our population. It is only in Sri Lanka where this was lower at 20.9%. Even though Sri Lanka showcases a comparatively low percentage within the South Asian region, this value is twice the global lowest percentage of the category. 10.2% is is the percentage for the USA. And here, I think what is of particular concern for us in Sri Lanka is the fact that was mentioned earlier also, is that now our figures are becoming entrenched. They're not shifting. This is what is particularly worrying for us, because it is the numbers are not changing, and the numbers are not changing in communities that have experienced anemia for generations. So we are clearly not doing something right, and we really need to understand why these figures are not shifting. This is our challenge in Sri Lanka, and I'm sure in many other parts of the world as well. During the 2022 economic crisis, preceded by the COVID-19 pandemic, the nutritional status of the population, particularly among women and children, significantly deteriorated, raising serious concerns. The government of Sri Lanka, despite many challenges, has focused strongly on addressing all forms of malnutrition and micronutrient deficiencies, including nutritional anemia. Sri Lanka has made considerable progress in improving maternal and child health over the past decades. Yet, we too continue to struggle with high levels of anemia, particularly among adolescent girls. I am pleased to state that the government of Sri Lanka has made a policy decision to continue without interruption the school nutrition program aimed at reducing anemia among school children, which is being implemented with the assistance of the World Food Programme. According to the National Nutrition Policy of Sri Lanka 2021-2030, which has been approved by the Cabinet of Ministers, several key targets have been set to address anemia by 2030. Among our top priorities are reducing anemia in the first trimester of pregnancy from 18.3% to 9%, halving the prevalence of anemia among pregnant women by 28 weeks from 30.3% to 15%, lowering anemia in primary school children from 11.7% to less than 10%. Excellencies, friends and colleagues, anemia in women and girls is a challenge that demands a regional response. Addressing anemia, therefore, requires a comprehensive, multi-sectoral approach that transcends national borders. Collaboration and coordination among government, civil society, health sectors, education systems, and international partners are essential to driving sustainable change. We have understood that addressing this issue requires more than medical intervention. It requires an integrated, policy-based approach, one that combines nutrition, education, gender equality, sanitation, social protection, and community engagement. In moving forward, it is critical to recognize that anemia among adolescent girls and women in South Asia is not just a health issue, as was discussed earlier. It is deeply gendered. The burden of anemia disproportionately affects females due to biological, social, and structural inequalities. Factors such as early marriage, gendered food hierarchies, menstrual health taboos, and limited access to education and healthcare contribute significantly to this disparity. Many of us, I think, have experienced for ourselves being told when you've started menstruating that you shouldn't eat certain foods, or that you should reduce eating certain types of food, or the fact that boys need more food than girls. And we know it is a practice among many of our families for mothers to eat last and mothers to eat what is left over. This becomes even more challenging when the economic situation becomes more precarious. It is inevitably mothers and girls who get the least amount of food, because there is the understanding that, well, mothers will always sacrifice and girls need less food. So the gendered nature of this problem, I think, has to be really understood and is at the heart of the issues that we are trying to deal with. Therefore, any effort to reduce anemia must center gender equity and social exclusion as fundamental principles rather than as add-ons. In this context, I would like to suggest that the following key aspects be prioritized when devising country and regional programs. Strengthening regional collaboration in research, data collection, data sharing, monitoring, and evidence-based policy making. Strengthening nutrition-sensitive and nutrition-specific programs targeting adolescent girls and women. Promoting gender equity and social inclusion as core principles of all health and nutritional interventions. Empowering communities, especially young girls, with education on nutrition and reproductive health. And here I just want to add something that, we tend to make an assumption that access to education will naturally result in the empowerment of women and girls. And let me just tell you that in Sri Lanka, our experience is not that. That's not enough. Just making sure that girls access education doesn't necessarily mean that empowerment will follow. I think we really need to examine the kinds of structural issues that keep women or exclude women from decision making, from accessing resources, and that it's not just lack of education. I mean, education is key, there's no argument about that, but I don't think we can assume that simply accessing education or information will result in a difference in when it comes to decision making for women and girls. Investing in food systems that ensure access to affordable, diverse, and nutrient-rich diets. Mainstreaming gender-sensitive health services into national development strategies. Engaging community and families as active partners in health promotion and behavioral change, and ensuring that no adolescent girl or woman is left behind in national development agendas. Excellencies, friends, and colleagues, as we engage in deliberations at this conference, or as you have already done, let us be bold in our vision and united in our purpose. Our vision is clear: a South Asia where no adolescent girl or woman suffers from preventable anemia, where every girl has access to nutritious food, health, education, and quality care, and where communities empower women to realize their full potential. Let this conference be a milestone for renewed commitment and concrete action, not only from governments, but from every sector of the society. The challenge of anemia in adolescent girls and women is formidable, but not insoluble. With renewed commitment, regional solidarity, and collective action, we can nourish South Asia's future generations, breaking the cycle of malnutrition and building a healthier, more equitable society for all. I look forward to the rich discussions, to the impact of the rich discussions, exchange of ideas, and concrete commitments that will emerge from this conference. Together, let us pledge to make anemia reduction a regional priority and a shared success. I'm really pleased that Sri Lanka was able to host this conference and bring all of you together, and we recognize the fact that we are in a unique position to do so, and we intend to make sure that we fulfill that role as much as possible. Together, let us nourish South Asia by beginning with those who nourish it every day, our women and our girls. I wish you a professionally fulfilling and personally memorable stay as you immerse yourself in the warm hospitality and unique charm of our beautiful island. Thank you very much.